The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Cheryl Burbridge is an LPN at the ER at the Valley Regional, and she says that conditions on the floor at her emergency department are so overcrowded now that they're actually dangerous, and that nurses there are having to look after so many patients that it amounts to being a violation of their standards of practice. Staff in that ER are working at 200% capacity many days. So I want to ask the Premier, wouldn't it be better to make the investments in health care that would take the pressure off ERs rather than run a generation of nurses into the ground?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. Mr. Speaker, that's why we continue to invest in collaborative care model, Mr. Speaker, to ensure that people have access to primary health care in community, Mr. Speaker. As you would know, the model of health care delivery is changing rapidly. He would also know family practice nurses are becoming an important part of that. That's why we continue to hire more family practice nurses to become part of that team, nurse practitioners as well. He's heard me say many times that some of our community social workers should be part of that a whole healthcare team model. And that's how we continue to believe that we can lessen the pressure on our emergency rooms across the province by continuing to build the model of healthcare that healthcare professionals want to work in today.
The Honourable Leader of the New Democratic Party.
In Lower Sackville, the Cobequid is keeping patients overnight because the other ERs are so overcrowded there's no place to make the transfer that they're supposed to. Staff are working overtime in order for this to happen. And last year, the NSHA's nurse overtime budget was exceeded by a factor of more than 4. So I want to ask the Premier, wouldn't it be a better use of our resources to make the investments that would take the pressure off ERs in the first place, rather than continue to spend endlessly on overtime?
The Honourable Premier.
Mr. Speaker, that's exactly what we're doing, Mr. Speaker. We've heard me talk about the redevelopment of the healthcare infrastructure that we have in the capital region, the redevelopment of the infrastructure in Cape Breton. We're talking about building the collaborative care centres across the province, Mr. Speaker. That's exactly what we're doing, Mr. Speaker, building the infrastructure that had not been invested in, Mr. Speaker, for decades. We need to make sure we make those investments because that's how we will attract, retain healthcare providers and build the appropriate healthcare environment where all of our healthcare professionals want to work in.
The Honourable Leader of the New Democratic Party on his final supplementary.
But the question of emergency room staffing across the province is not becoming less of an issue, it's becoming more of an issue all the time. We've learned just lately that the QE2 is having a hard time filling nursing shifts at the Rapid Assessment Unit, following changes in what the hospital counts or doesn't count as overtime. While emergency RMs are meant to staff that unit, the department is now asking LPNs without emergency training to fill those shifts. So I want to ask the Premier, wouldn't we be better to make the investments in more nurses and lessen the pressure on ERs in the first place, rather than leaving our emergency rooms understaffed?
The Honourable Premier.
Speaker, I want to thank the honourable member for the question. I want to remind him, I'm sure he paid close attention to the fact when the Minister of Finance tabled her capital plan this morning, Mr. Speaker. There is a significant investment in healthcare infrastructure to deal with the very issues that the honourable member is talking about. Mr. Speaker, I, like him, would prefer to have that infrastructure in place today, Mr. Speaker, but the honourable member, when he was in government in his power, did not address the issues that were facing Nova Scotians, Mr. Speaker. The reality of it is we are taking this issue seriously, head-on, making the investments, ensuring that the infrastructure reflects today's reality and will be there for the next 50 to 60 years, Mr. Speaker.